Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUM News Extra. Tonight we've got a special show for you as we will be covering an array of health-related topics. Joining me in studio is Dr. Jitka Lom from Express Care. Thanks again, Doc, for coming in. Now we've got a wide range of topics that we're going to get to tonight. So let's start off with, is it true that pregnancy eases migraine headache symptoms in women?
Well, Mindy, the answer is some of the time. About 2/3 of the time after the second trimester, women will experience relief from their migraines. But 1/3 of women will get worse during their pregnancy and actually experience their first migraine during the first trimester. So if you're one of the lucky ones, things will get better.
How do you know the difference between a regular normal headache and a migraine?
Such a great question. So migraine headaches, the classic kind, tend to be one-sided behind the eye and associated with other things such as flashing lights, zigzaggy lines in front of your vision, intolerance of loud noises, and also vomiting and nausea. It tends to be a much more severe headache, and people can feel it coming on with like an aura, and it can last a day or two even.
Wow, okay. Yeah. What is weight cycling and is it harmful?
Weight cycling is when people go from a higher weight to a lower weight, back up to the higher weight, up and down like a yo-yo. Not necessarily due to yo-yo dieting, but that's a common cause. And is it harmful? Studies are not clear on that. It's not helpful to your self-esteem if you're trying to lose weight, because you always keep bouncing back up and feeling like you've failed. But for your overall health, it's not clear whether it makes it worse down the road for you or not. Ideally, you would achieve your ideal body weight and stay there.
Okay, I got another one for you. Is there a link between shingles and chickenpox?
Yes, there really is. Okay, so when you were a child, you might have had chickenpox. That was caused by the varicella virus. That virus stayed in your system after you controlled it with your own immune system. That virus stays in your body for the rest of your life, and it remains in the spinal cord. And then later on in life, if you become a little weak or tired, your immune system stops paying attention to that virus, which is still there, and the virus will become reactivated. And instead of causing chickenpox on your whole body, it will affect just one nerve that comes out of your spinal cord. And it will affect that one nerve in one area of your body and give you a really bad blistering rash. Very, very painful. So it can be anywhere on your body, but it's just one side with a bunch of little blisters on a red base, typically very painful. And so it's a reactivation of the chickenpox virus, and you can treat it with medication. If you come in within the first 72 hours, we can give you medicine to help you. And sometimes once the rash goes away, which can take up to a month, the pain still remains because it's nerve pain, and that can also be treated. There's also a vaccine now for elderly people called Zostavax. That one's available to help prevent shingles, and it's covered under Medicare.
Okay. Knowing the type of climate and weather that Guam has, what is the best way to treat acne?
Acne, okay, so acne is a combination of factors, hormonal factors, oil on your face, and bacteria. And these are bacteria that we all have, but they need oil to grow. And that's what happens in a hot, humid climate. We produce much more oil on our faces. So to reduce our oil production, if you can blot, use a blotting paper to get the oil off your face, wash twice a day with a mild cleanser, and you can use medication like benzoyl peroxide or prescription medicines to help reduce both the oil and the bacteria. But you can start with a good cleaning.
Okay. What increases the risk for a woman to develop gestational diabetes during pregnancy?
Okay. Gestational diabetes is sort of a preliminary to diabetes later on in life. And the factors that would make it more likely would be if you have a family history of diabetes, if you've had a previous gestational diabetes child, if you've had a really big baby in the past, if you're over 25 years of age, and most importantly, if you've gained a lot of weight during your pregnancy. So ladies, please, during your pregnancy, watch your weight, don't eat for two, and exercise.
That's hard to do.
It is hard.
All right, what is psoriatic arthritis of the feet, and how can it be treated? And I'm assuming that this has to do with psoriasis.
Right. So psoriasis is a scaling skin condition that people will get all over their bodies, a bad rash. But in about 15% of people, they will also get arthritis with it, where they'll become swollen on their fingers and toes especially, quite painful. It can affect other joints too, but on the feet it can be quite disabling because their toes become like sausages, very swollen, very tender, and it's even hard for them to walk. And so the treatment that we have for that are first anti-inflammatories like Motrin and Naproxen, these type of medicines to take down the swelling. But then we also have some other more powerful medications, which are pills and shots that can take down that swelling and help prevent disability, because if that inflammation keeps on going, there's actually joint destruction, and people can be actually disabled, unable to walk.
Wow.
Yeah.
And then how do you treat psoriasis just in general, just anywhere else on your body?
Well, it's a great question, Mindy. Psoriasis is a dry skin condition that has been caused by your own immune system malfunctioning. And we settle it down with steroid ointments to start with, and moisturizing. Those are the two most important things, to moisturize as heavily as you can with Vaseline or oil. Anything that's sticky and greasy works great. And then the steroid ointments work. And if those don't control it, or if it's really all over the body, which it can cover your 90% of your whole body, it really can, then we use tablets or shots. And it's long-term therapy. Psoriasis cannot be cured, only controlled.
Okay, well, good to know. And we will be back with more questions, all kinds of questions that we have for Doc right after this. Stay with us.